Hey you guys, it's Nurse Desi. I am back with another video. If you guys are new to my channel, let me introduce myself. My name is Destiny. I am a 23-year-old ICU registered nurse, and I just recently announced that your girl got accepted into CRNA School. So if you guys are interested in seeing nursing content and soon to be student nurse anesthetist content, please like, comment, and subscribe and follow along for the journey. All right, you guys, so today is April 16th, and today is my shift 1 out of 3. So this vlog, I'm going to take you guys along with me to my 3-day work week as a night shift ICU nurse. And I'm going to do a debrief after every shift so y'all can know what type of patient that I have, what type of things that I did, and how my shift went. So since I have not vlogged in so long, y'all, my last video I've uploaded was me passing my CCRN. So I want to give you guys a quick little update on the way to work today of like what's been going on with me as far as work, also with CRNA school, and my personal life, like what has been some things going on. So first I'm going to start off with some work updates because y'all, your girl has been working. I have been working hard. Y'all know I'm about to start CRNA school this August, so I'm trying to work, get some things paid off so that I cannot be stressing out as much when I start school, because y'all know with CRNA school you cannot work majority of the time. Now I will probably work PRN the first semester, but after that I'm not gonna work after that. So your girl's been working really hard, but I've had some exciting things coming up for work. So number one is that after I passed my CCRN, my educator decided to make me a preceptor on the unit, which I am so excited about because I feel like being able to precept and teach the new grads coming onto your unit is such a huge reward, because you can really mold somebody's experience as a nurse and really help start them off on a good path so that they could be able to just be a great nurse. So I'm so excited about that, especially because in the ICU, y'all, a lot of ICU nurses have a bad reputation for being like a very mean preceptor or being very critical of their orientees. And I understand that you have to let your orientees understand that being an ICU nurse is extremely important, and you do have patients' lives on the line. So any mistake or forgetting something can definitely cost a patient their life or just have huge consequences. So I understand why a lot of preceptors take that approach, because they're trying to make people understand how serious it is. But I just do not think that that's the best way that you can educate people. And I want to just give my orientees some grace, because y'all, being in ICU, you have to have so much critical thinking and also have so much skill set in order to take care of a patient, be able to respond to emergencies, be able to assess a patient quickly and understand when something is going wrong and what interventions to implement, because there's not a rapid response team in the ICU. You are the rapid response. So if your patient starts going downhill, you have to know every step of what to do to help your patient. So I feel like nobody talks about that, but you have to have so much understanding of this stuff, and I don't expect anyone to just come out of nursing school and just know this stuff. Or even if you are a Horizon that has started off on med surg and came to the ICU, I still don't expect you to know all those things, even if you have previous experience, because ICU is just different from any type of unit that you've been on. So I am really excited to teach my orientees and try to take a more graceful approach, and of course still give them great training, great education, but just like create a environment that is not so hostile and just like toxic. So I'm super excited about that. And then also I've been taking classes, trying to learn as much as I can learn before I go back to school. So that's basically the work update. As far as my school update, so y'all know I will be starting CRNA school August of this year. So back in March, I just registered for all of my classes. I'll be taking 5 classes, which is, y'all, that sounds like a lot. But the first one's going to be chemistry, and then the rest of them are going to be more of my, you know, DMP type of like writing courses, stuff like that. But I'm really, really excited, and your girl has been just getting all the things uploaded to the school so that I can start. I'm doing my credentialing, so just uploading all of my like ACLS, BLS, my license, just getting everything sent to the school. I will soon be getting my scrubs because I have to get them embroidered with the school name, and then I just got invitation to come to orientation. So orientation is going to be a week before I start classes, and my first semester is all online, but orientation is in person, so I will have to go out to the school to go to orientation. So I'm so excited about that, and just so many good things. Like I'm really happy I chose the school that I chose because they are just so nice and helpful, and any questions that I have, they are willing to help. So I'm just really excited about this journey from going to bedside nurse to student nurse anesthetist. I'm just so excited. So can't wait for those vlogs. Whenever I'm studying and starting school, I'm gonna be vlogging for you guys, so I'm really excited about that. And then as far as personal, so since I've been working so much and going to school, like trying to prepare to go to school, I decided to take a 2-week vacation last month, and I went to Florida. I took 2 weeks off of work. I'm so glad I saved up my PTO, and I'm planning on using my PTO because I am not about to be working for 3 years, so I want to make sure that I am going on vacations, taking time to relax. Of course, I want to save up money, but I still want to make sure that I'm enjoying my last year of just having all this free time. So I went on a vacation. I went to Florida, had a ball, and my birthday is coming up in June, so I'm planning on taking another vacation. I got my PTO approved for that, so I'm just so excited, y'all. Like, I am just getting things in order to start school, start my new life, because I do have to move to the area that I'll be going to school at, but I'm not going to do that until closer to the end of the year because I do have a little bit more time now that I am going to be online the first semester. So I'm not in a rush to move. I'm going to move before I start the spring semester of 2026. So that is my plan. Just really excited, and I will update you guys when I get to work and after my shift for shift 1 out of 3. Hopefully they treat me good, y'all. I had a great week last week. I had 3 shifts with great patients, and it went by so fast. So hopefully I have another good week, but I will update you guys on how it goes. Bye. Hey you guys, so I'm out of shift 1 out of 3, and last night was not that bad, y'all. It was really not that bad, but I came in and I was tripled. And y'all know, if you an ICU nurse and you come in and you're triple, you're not happy. Being triple means that you have 3 patients. Everybody knows ICU, the ratios are normally 2-to-1 or 1-to-1 because ICU patients are so critical. And we don't play about our ratios because it really does make a difference in patient safety. When you're able to closely watch your 2 patients, you can pick up on things way faster, and you can assess your patients way faster and be able to like provide the care that they really need. When you have 3 patients, 3 real ICU patients, sometimes it can be so tasky and you may not be able to like give everybody your full and divided attention, and it can cause some issues for sure. But I actually had a really good triple last night. One of my patients had transfer orders, and then the other 2 were like true ICU patients. But even when you have a patient that has transfer orders or seems stable, you still have to make sure that you are going in there and assessing your patient, because those are the patients that actually turn on you the quickest, and those are the patients that can go downhill very fast if you don't like keep an eye on them. But I had a great load last night. All 3 of my patients were perfect. And I love when I'm tripled and I'm able to provide great care to all 3 of my patients. Because to me, that shows like I've really mastered being an ICU nurse. I've mastered my time management. I've mastered prioritization, because that's when you really have to use your skills as a nurse, because everybody is not going to be able to have you in their room all at once. So you have to come in and be able to assess who's my sickest patient, who's my patient that is going to be the easiest, and then who needs the most attention, who do I need to be in the room the most. Like, you really have to figure out what patient needs you the most and figure out where you can, you know, divide the care equally. And I feel like I had perfect time management last night. Like, y'all, I gave all my patients a bath. All my patients was turned, clean, the vital signs were stable. And even in the morning, I got all their labs, replaced everybody's electrolytes, like potassium, magnesium, calcium. Everybody was well taken care of. So I feel very proud of myself. And it's crazy because I actually had a lot of downtime. Like, even though I was doing a lot last night, I still had some downtime. So I feel like it was a great triple. And since I was triple, I know for a fact I'm not going to be tripled again tonight. So that's good. And I don't know who I'm going to get back, because if you're tripled, you don't really know who your assignment's going to be. But regardless, I know I'm going to have a good shift. So I will talk to you guys later, and bye. Hey you guys, today's April 17th and I'm dressed and ready for shift 2 out of 3. Y'all, the one thing I love about nursing is the schedule. Like, these 3 days, especially because I knock out my 3 days in a row, the 3 days go by so fast, and then before you know it, you're off for 4 days. And then if you ever want to book a vacation, you can get at least 8 days off not using any PTO. So just amazing. If you're thinking about going into nursing, that is one of the biggest pros, is the schedule. So I'm about to go get some coffee, and I packed my lunch. I've been doing really good on bringing my lunch and not eating out, but I still be needing my coffee. So I'm gonna get a coffee, and then I'll see you guys later. Hey you guys, so I am home from shift 2 out of 3. And y'all, last night was such a good shift. Like, it was like the perfect ICU shift. So I came in, I was not triple, thank God. I only had 2 patients, and I had one of my patients that I had last night, I had them back, and the patient actually was very stable, and the patient had transfer orders, but the patient never got a bed available, so I didn't even have to transfer the patient out, which I got lucky, because y'all, transferring a patient out can take a lot of time, and sometimes it's not ideal when you have a critical patient on the unit, because you're trying to do all your things for your critical patient, but then you're also trying to transfer your other one out, and it can just be a lot. So I was really glad and I had to transfer her out. And I love to keep an easy patient, because when you transfer a patient out, that means you have an open bed. That means that you can get an admission, and then the admission that you get can be a mess. So I'm glad I got to sit on her all night. So I had one patient, and then the second patient that I had was actually a new patient. This patient had just had a kidney transplant, but unfortunately the transplant did not go well, and the new kidney is not working. So the patient came to the ICU to be started on CRRT, which is continuous renal replacement therapy, which is pretty much just another form of dialysis, but it's a safer form, and it's for ICU patients that are unstable as far as their blood pressure is too low, or who cannot tolerate pulling massive amounts of fluid off, like HD. So got that patient started on CRT, and I love a CRT. Like, that's probably the best machine to run in the ICU. I have really gotten good at starting up my CRTs, and then also like making sure that I'm pulling the correct amount of fluid, because depending on what the goal of the patient is, the nephrologist will make a pull goal. And if the patient is like extremely unstable, you are not most likely not going to be pulling any fluid off. You're probably just going to be filtering the patient's blood. But for this particular patient, the patient was fluid overloaded because the kidney was not working, so they're not peeing or excreting any fluid. So they wanted me to pull 150 an hour. And with ICU patients, they can be a lot, because any amount of fluid trying to pull on these patients will affect their blood pressure, or their heart rate, or something will start happening. But I have found a way that like I can pull fluid without like drastically dropping my patient's blood pressure. So I've mastered the calculation, because like everybody does their CRT a little differently. So some of the nurses will calculate all their intake, and then they will just go up on the pull rate depending on if they give any more fluids, like if they're giving antibiotics or electrolyte, like anything that they're giving, you have to account for that, because if if you are giving a lot of fluids, then you're not pulling enough if you're not adding up the amount that you're giving. So me personally, I calculate all my intake for the whole shift. So any continuous fluids, tube feedings, oral intake, I calculate that, and then I divide it over 12 hours, and then I use that as my pull rate, because it tends to be a lower number, and that will help you pull the fluid off your whole shift instead of trying to pull it every hour, because not every patient's blood pressure can tolerate that. So I'll do a calculation on that one day to just show how I calculate that, because a lot of new grads don't know that, and they'll come and ask me like, what do I do? And then a lot of times they won't be pulling up enough fluid, and then by the morning all the doctors come by and they'll look at the chart and they'll be like, well, why are you positive, or why you didn't pull any fluid? And it's because they're just like, the method that they're pulling is just not effective. So I'm happy I pulled fluid off my patient. I changed all their central line dressings. Both my patients got a bath. Like, it was a really good shift, and it wasn't even busy. Like, I had a lot of downtime, but I was still being very productive. So I'm glad I had a good night. I'm sure when I come back, one of my patients is probably going to be gone, the one that had transfer orders, but I'm pretty sure I'll have the one who's on CRT back. So I will talk to you guys when I am dressed and ready for shift 3 out of 3. Y'all see how fast these shifts go? Like, these shifts literally, like, by the time you blink, you're done. So I love that about being a nurse. So I'll talk to you later.
Hey guys, today is April 18th and it is Friday. I'm dressed and ready for my 3 of 3, and I'm excited to get this over with. It is so nice outside. It's like 85 degrees and I gotta go to work on a Friday night. So sucks, but at least I have Saturday, Sunday, Monday, Tuesday off to do something. So I will talk to you guys either at work or after work.
Hey you guys, so today is April 19th. I am off of work. I did not come back and tell you guys how my shift 3 of 3 went, because y'all, my last shift took me out. Like, it was so emotionally taxing, and I'm not even gonna say it was a bad shift, because it really wasn't. It was just like, it really pulled on my heartstrings, and like, once I got off of work, I had to really soak into what just happened and what I saw, because I wanted to be real with you guys and tell you guys that every shift as ICU nurse is not always good. Sometimes you will see some of the most traumatic things happen to people, and just knowing that you can't change the outcome, it's very, very sad. And that was kind of the shift that I had last night. So I'll give you guys a quick little debrief. I can't get into the details that much because of HIPAA, of course, but I'll tell you guys a little bit of what I saw. So I told you guys the shift 2 out of 2 was great. I had a patient that was on CRT, and then my other patient had transfer orders. So of course I came back. I still had my one patient, but then my second one got transferred out because she was supposed to leave the ICU. But then my one that was on CRT actually got taken off of CRT because we pulled enough fluid, and now we're going to transition her to HD. So that's the regular, her regular dialysis, because she's getting better. So I had that patient back, and then I got one new patient. And the new patient that I got was unfortunately a Tylenol overdose, which is just very sad, because y'all know Tylenol affects the liver. So if you ingest a large amount of Tylenol, you will go into liver failure, and it will be very, very bad. And I'm sure y'all probably saw that video on TikTok that said the sickest patient that you will see in the hospital is a patient that is in some type of acute or chronic liver failure. Those are hands down the sickest patients that we see. So to see that, you know, an overdose cause that much is just very traumatic. But thankfully we do have an antidote to Tylenol, but sometimes the treatment is still not guaranteed treatment. But we did do the antidote to the Tylenol to try to reverse the damage and just like monitor closely. So it took a lot to get that patient settled down.
So y'all, for the first like 4 to 5 hours, I was running my butt off. And then to top it off, like my patient started spiking a fever. And y'all, if you're a nurse, don't take a fever lightly. I know a lot of nurses will be like, oh, the patient has a fever, I'm just going to give them Tylenol. But if a patient has a Tylenol overdose, you can't give them Tylenol to treat a fever. But sometimes when you treat a fever, it may mask the fact that the patient is getting septic. So make sure if you do treat the fever, also tell the providers that this patient is spiking fevers if this is a new thing, because you want to get the patient treated as soon as possible. And sometimes that may prompt the provider to order more things like blood cultures, or sometimes do a whole sepsis bundle to make sure that the patient is not getting septic. So that is what we did. We got a chest x-ray, we got blood cultures, we sepsis bundled her, got the fluids, antibiotics, all the things. And then after that, the patient started getting better. So that did show the patient was getting septic. So I'm glad that I jumped on it and made sure that we did not prolong the process. So y'all, by the time I like really sat down, it was like 4 a.m. So I had finally got caught up on both my patients, charted everything, got them both settled in. And then of course my charge nurse comes up to me and was like, you're gonna have to give away one of your patients to admit a new patient from the ER. I was like, oh my gosh, because y'all, it was my 3 of 3. I was about to be done with my shift, and now I have to admit another patient. So I gave away my easier one, and then I kept my Tylenol overdose patient, and then I admitted into a new room. The patient that I admitted was from the ER, septic as well. Thankfully, the ER did the sepsis bundle for me, and they also took the patient down to CT. So I'm like, thank God for a good ER nurse, because she was amazing. So by the time I got the patient, everything was mainly done. But we noticed that the patient was getting septic from a wound the patient had. So always, if you get a new patient from anywhere, ER or from the floor or whatever the case is, if they have a wound, make sure you take off the dressing and really assess the wound and clean the wound, change your dressing, and just have a good idea of what the wound looks like. Because even if you get told in report, oh, patient has a wound, you still want to see it with your own eyes so that you can assess it. So as soon as I admitted my patient, I changed the wound dressing, cleaned it, did a moist to dry dressing. And when I pulled the dressing off, the wound was just 10 times worse than what I expected it to be. And I just had a bad feeling. I'm like, this isn't a typical wound. This looks like something bad. And come to find out, it was necrotizing fasciitis. And it was just so traumatic because the patient did not know that they had it until we got further testing. That's when we were able to formally diagnose the patient with neck fash. And for y'all who don't know what neck fash is, it is a flesh-eating bacteria that will kill you. It will eat up all of your flesh. It will cause you to become septic, and you will die if you do not get the area either amputated, or they have to go in and do a major surgery to remove the infected tissue and then allow the healed tissue to pretty much heal, and then they can try to make you get better. But it is a long, traumatic process, extremely painful. Those patients get extremely sick, and just to see a patient that was diagnosed with that, it was just so heartbreaking, so sad. So on both cases, it was just such a heartbreaking scenario. Like my other patient has a Tylenol overdose. This patient has neck fash. Just very, very sad. Very sad. So I am praying hard for my patients, especially Easter's coming up. They have to spend it in the hospital. So if you guys are home and healthy and safe, pray for the patients in the hospital and in the ICU that are fighting for their lives right now. It is just so heartbreaking. So that was my 3 of 3. I'm not gonna lie, I was so glad I was not back again because I was already very traumatized. I couldn't even come on and talk to you guys after my shift because I was just very heartbroken. But I came home, took a nap. Now I'm up and ready. I'm about to spend some time with my family for Easter. So I am just gonna end this vlog off, but thank you guys for watching this video. Please like, comment, and subscribe, and I have much more content coming soon. So talk to you guys later.